Welcome doctors, let's talk about something that almost every one of us has wrestled with, prior authorization. It was designed to make sure care is medically necessary and cost-effective, but in reality it's become one of the biggest frustrations in our daily practice. Think about it. Each insurer has its own forms, its own rules, its own timelines. Sometimes we're filling out separate paperwork for the same procedure just because a patient's insurance changed. Then there's the mountain of documentation, medical histories, labs, clinical notes, just to prove what we already know, that our patient needs care. And even after we've jumped through those hoops, approvals get delayed, or worse, denied. Then begins the cycle of appeals, phone calls, and endless follow-ups. For many practices, that means spending the equivalent of 2 full business days each week just dealing with prior authorizations. That's 2 days we could have spent with patients. And let's not forget the impact on our patients themselves. Delays mean delayed medications, delayed imaging, delayed procedures. For someone with a critical condition, that wait can mean worsening outcomes, missed appointments, and plenty of frustration. We end up being seen as the ones slowing things down, even though the real roadblock sits with the insurance company. This takes a toll not just on efficiency, but on our relationships with patients. It's painful to know what treatment is right for someone and still have to hold back because we don't yet have approval. That moral distress is real, and it chips away at the trust and satisfaction in the exam room. Of course, the financial side is just as tough. Hiring extra staff to manage prior authorizations increases costs. Denials and appeals eat up resources. And until that approval comes through, billing and revenue are stuck in limbo. Smaller practices especially feel the pinch, and many are struggling to keep up. Technology was supposed to help. Electronic prior authorization systems exist, but adoption is spotty. Some insurers play ball, others don't. Integration with EHRs is incomplete, and often we still end up sending faxes or making phone calls. Without full automation and interoperability, the burden remains squarely on us and our teams. On top of that, the regulatory landscape is constantly shifting. Between federal and state rules, staying compliant can feel like a full-time job in itself. And if we get it wrong, we're looking at errors, delays, or denials. So what can we do? While we can't eliminate prior authorization headaches entirely, we can make them more manageable. Many practices are investing in dedicated staff or outsourcing these tasks to free up clinicians. Others are leveraging EHR integrated tools to cut down on errors and streamline submissions. Standardizing internal workflows and creating clear protocols for handling PA requests can make the process smoother for everyone involved. Another key piece is patient education. When patients understand the process and the possibility of delays, they're often more patient and less frustrated with us. And finally, we can't forget advocacy. Engaging with professional organizations, pushing for reforms, fighting for standardized, simplified processes are the only ways to truly change the system in the long run. So, what have we learned here? Prior authorization may have been created with good intentions, but it has become a major source of administrative complexity, treatment delays, and financial strain. Until systemic reforms come, our best bet is to streamline what we can, support our staff, educate our patients, and keep pushing for change. Doctors, you're not alone in this struggle. Every one of us is navigating it, and together we can push toward a system where prior authorization does its job without standing in the way of patient care.